This is the TINS 3000. Here. Hanging around in the back. I made a few Robocops.
Been a while. I was little when I saw it.
The SUX 1000. Those are called.
That's what that is.
It could be, most TINS units have their own name, but this just happens to be a 3000, but they all have the same controls to them, all right? So when you unbox one,
Do you need this?
nope, what's going on here? You should find a pair of electrode pads, or a set of electrode pads, an instruction book, two sets of lead wires. Break my lead wires, I'll wring the neck. And the TINS unit itself. Put this over here. Alright, so here's where I gotta have somebody. Because I can't do this. I'm gonna lower this down so you can see. That way you can keep everything in frame. Alright, so on the top, what you have on the top is the place where you place the lead wires. And underneath this plastic cover is where we have our amplitude control or intensity control. Okay, now this is analog, and you turn it up. Where'd my pencil go? This dial right here controls this lead. This dial right here controls this lead. All right. Notice that. Can you zoom in for a little bit for me? Just go down closer.
I think the flashes.
It's better. All right. You notice that it goes from dot, meaning 0, to all the way up to 8, which would be the max. Okay. So that's the protective covering, because this is a portable form of pain control. Okay? This is not something that you would do in the clinic, because in the clinic we have our IFC, we have our pre-mod, which are better at pain control than these are. Okay? These are for a patient to take home. Okay, now let's open this up. Most of them are operated off a 9-volt battery or AA batteries. Okay, this one is AA. I'll show you it. It's a little fancier than this one, and 9-volt. All right. So right here you see you have B, N, and M. Okay, B stands for burst mode TINS. Burst mode TINS selectively tries to get the body to release endorphins, endogenous opiate endorphins. And endorphins tend to last up to 4 hours, and it requires a muscle contraction for you to release the endorphins with this TINS unit. So treatment times, if you're in burst mode TINS, are 20 to 30 minutes, no longer. The reason is because you're causing a contraction, a purposeful contraction, that will cause muscular soreness for the patient. So that's the reason why the treatment time is 20 to 30 minutes. Okay? Now when I say burst mode TINS, it comes in burst trains. It goes boom, 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 like that. Okay? So if I wanted to do that, I would flip the dip switch. Would that still be a dip switch, dipole switch? Trip switch. To burst. Okay? N stands for normal. Some TENS units call it conventional. That means once you turn it on, it goes and it selectively targets enkephalins. Enkephalins are the endogenous opiate that lasts for seconds to minutes. Pretty much after you get done stimulating them, they will go away. They're short term, right? With and in normal or conventional mode, we do not want a muscle contraction because this can be worn up to 24 hours a day in normal mode. Okay, so it's for all day pain relief. The M, it stands for modulated. And what it modulates is it modulates the frequency, which is pulses per second, how many times it's hitting you per second, and it will modulate pulse width, which is the same thing as pulse duration. Remember, that's how long each pulse is hitting you. Remember our strength duration curve that I drew out? Sensation, subsensory to the sensation line, the sensation to the submotor line, and then the motor line, and the motor line, then to the pain line. Remember that from the video? All right. What modulated mode does is it will modulate the frequency, the pulse width, and the intensity somewhat to prevent the body from accommodating to the stimulation. Sort of. After a while, in normal mode or conventional mode TENS, your body will say, let's forget about that. And you have to end up turning it up to get more stimulation. Okay? Most of the time, we run it in normal mode. Okay? Because this is going home to patients. Not that our patients are dumb or stupid, but our patients are ill-informed over burst mode. And if they say, well, if this give me 4 hours, 20 minutes give me 4 hours, 40 minutes ought to give me 8 hours. And then they end up being really sore and end up not trusting you. So I usually set my patients up in normal mode. I will set the pulse rate and the pulse width to what I want and tell them to leave this alone, only play with these. Okay. Now, down here is our time. We can have it set for 15-minute increments, where it will run for 15 minutes, shut off. 30-minute increments, or continuous. I usually leave it on continuous. So it's just going until they shut it off. Right? Now, pulse rate, or PPS, points per pulses per second equal 80 hertz. 1 hertz is 1 pulse per second. 80 pulses per second is 80 hertz. And just a different way of saying it. So that's how rapidly the pulse wave is hitting you. I believe a lot of the literature says that it takes 60 pulses per minute, pulses per second, 60 to 80 pulses per second to get muscle tetany. Now, it's not tetany as in tetanus. Tetanus, the disease, gets its name from the type of contraction it causes. Muscle tetany, give us some muscle tetany, give me a flex. Right now, his bicep is under muscle tetany. It's a smooth contraction, okay? It's contracted all the way, okay? And if he kept doing it for too long, he's gonna cramp up, all right? So, pulse width is how long it hits the patient. Remember, there is an inverse relationship between pulse width and intensity. As intensity goes up, pulse width can go down. And as intensity goes down, pulse width goes up. And they both feel exactly the same to the patient. We used to take time before we had to check off on all this stuff. And experiment with these and plot it out on a graph, and you could see that curve as we plotted it out on a graph. So typically what I do is I turn this all the way up to 260. That way it's hitting them the longest. That way they have more wiggle room here at the intensity to play with. I turn the pulse rate up to the highest. That way it feels smooth. 2 pulses per second. 4. Okay, that feels goofy to people. Now, this has a transformer in it that transforms direct current power from the battery to biphasic. So that means that colors don't mean a thing. Red isn't positive, black isn't negative in this case because it's biphasic. It could be purple and pink. It could be polka dot and striped. Doesn't make a difference because it's biphasic. All right? Now, this has 2 current generators in it. One generates current that comes out of this one, and one generates current that comes out of this one. There are several ways to apply the pads. One way to apply the pad is if, say, you had somebody with upper trap spasms. You could place the pads all around the pain, bracket the pain, surround it, and stimulate it. Or you could palpate and try to find trigger points. Yeah, that hurts. And place them directly over trigger points. Okay? And at the very, very least, if you are lost for where you want to put it somewhere between the brain and the pain. Because we're trying to interrupt that pain signal. So a lot of times, low back, all the way across. Sometimes you can put it just slightly above it, and it helps. Okay. I prefer the poking and finding the trigger points. If I can't find enough trigger points, then I will stimulate like muscle. For example, if I had upper trap pain, I could go. The reason why I keep bringing up upper trap is because it's a common place. Up in here is a common place that people get prescribed pins. Down here in the low back is a common place where people get prescribed pins. Right? So, if his upper traps are tight, we're trying to get him to relax. We're trying to get that pain cycle broken. There's a couple of different ways you can do it. I could palpate. Now that's a trigger point. Place one there. And then I can palpate, same spot over here, place one there. That's one lead. And I can put the second leads up here at the upper traps. So I could go here and here. Or you could stimulate like muscle. You can stimulate here and here, one lead. Here and here, one lead. Okay? You're just going to have to experiment with your patients and find out what works best for them. Okay? Is there a need to go lead 1, lead 2? You can certainly do that, but it is not required because it's not an interference current like the IFC is. Okay? So it is not required. Where IFC must cross or interfere with each other to be properly done, this doesn't. Right? So, if you're interested, let's see what kind of current this thing has. Warranty. Technical specifications, page 6. I was hoping he was going to tell us what kind waveform it generates. Usually these instructions book will tell you what kind of waveform it generates. And it's usually asymmetrical, unbalanced biphasic. Alright, everybody's seen a million of these, right? Okay, so we always want to prep the skin by wiping it down with alcohol. So, hand me that alcohol.
Yeah.
And a washcloth in the time. That's great. Perfect. Who is having upper tract problems? I know you are, but you've got tape over it. We can't put this over tape. I am not going to hurt you.
I'll do your test.
Right.
I say I can move.
Have a seat.
I don't even know if it moves either.
So every time before we place pads on somebody, we wash the skin off, right? Because body oils, makeup,
You work for it, you probably sweat it. It's gonna be a dirty man. Huh?
What?
you could take your shirt off, it should be a lot easier.
I don't want to.
Do you want a gown?
Maybe.
I need to have some on it.
That's all right.
It's hot.
Yeah. Let that dry.
I'm gonna all that skin off.
All right, so my experience tells me that I'm going to stimulate left trap, left upper trap, right upper trap. Okay? Might as well start somewhere. That's as good a place as any to start. Now, art, not science. These lead wires are going to hang down, so make your lead wires hang down. Right? Turn this way, the lead wire will pull down this way and pull down, right?
Can you put these on the spine?
Yes. No. You want to know the reason why I say no?
Well,
Is because some textbooks say you may interfere with the neural transmission of the impulse going from the spine up. Okay. Other textbooks say you can do it in the unless there is a presence of a laminectomy or laminotomy, which they remove part of the bony spine, thus subjecting or exposing part of the spinal cord itself. It's often done with disc herniations. They do it a lot. Right? I wouldn't have a problem with doing it, but most books, and I think your practice exams and my state exam, will say that it's a contraindication. So we'll go with that. All right. So. let's hook this up. You're next. Right, zoom in on this. Right, see that? See how the electrode, the pin is exposed a little bit?
Gosh.
Okay, I'm gonna go check on it.
Be sure that is pressed completely up inside there. Because while it's a low risk putting it on, it may still contact, and what it does is it will concentrate the current to that little bitty spot and it will bite them, okay? It's not very comfortable. So be sure you get those pushed flush.
Yeah.
Correct. So I'm gonna leave it on normal mode. I'm gonna turn my pulse width all the way up. I'm gonna turn my pulse rate all the way up. I'm gonna leave it on continuous. Okay? Now I'm gonna flip this open. And I'm gonna give them the same instructions. I'll pass them through the same indications, contraindications, and precautions as I would every other electrical modality. Okay. Flip this up. This one is going to your left shoulder. Tell me when you first start feeling it tingle. Alright. Tell me where it's nice and comfy.
Not there.
Right there. Alright, so you can tell that this channel is active by the green light, the green indicator light. Yeah, I'm gonna do the other side. First feeling. Alright, tell me when it's nice and comfy.
Not there.
Okay. And lock that down. Okay. I'm going to lock this down. And I'm going to give this to my patient. And tell them you can wear this 24 hours a day if you want. Do not wear it in the shower. Do not wear it while you drive. Do not wear it while you sleep. Do not put it translevery, like temple to temple. Okay? Don't put it over your genitals. These things must be said because it's all been tried before.
I can imagine, but someone's trying to get in a little extra help.
Then what I tell my patient is, see this stuff in here? Don't mess with that stuff. See that? You can mess with this. You can turn it up. Because if something happens and this flips open and you actually turn it up, you might go,
Kill everybody.
same way with when you're asleep.
Yeah.
You roll over the bed and you
lately.
come back on.
Yeah.
Shower is obvious,
right?
Water.
Right, so, now, what I should have done is, if Aaron was a real patient, what I would have done was I would have dropped these down, his shirt, on one side, because it's got a belt clip to it. You clip it to his belt. The cords are protected by his shirt, so they don't get hung and snagged on things. Now, describe that sensation.
Tingling.
I'm gonna put you on burst mode. You tell me what changes.
Kind of like a, I don't know how to describe it. Yeah. No, it's not even, that's very,
You can see the lights bursting.
What is the treatment duration for a burst?
20 to 30 minutes. Now, if I were to do burst, what I would have to do, I'm gonna turn this up. All right, see how I'm getting a contraction?
You want.
You want a contraction.
Bob and
And that's the reason why.
I can feel it.
Are you sure?
That is why the treatment duration is only 20 to 30 minutes, because this contraction can cause muscle soreness.
Yeah.
Not look comfortable.
Now I'm gonna turn it to modulated. You tell me what it feels like.
Good. Nice. It's just like a very constant buzzing.
Do we do anything else, or is it just?
I just feel the zzz.
Okay.
I can feel a contraction around a little bit.
What does it feel like though? Like a
Yeah, just that. All I feel.
Now, these things are powerful enough. Aaron, if this gets to be too uncomfortable, start hollering and I'll turn it down. Okay?
Okay.
But I want to demonstrate. We're doing your left.
Yeah, I felt a contraction.
Okay, just relax. So you can turn this thing up.
How far up? How far up?
Let's see. You turned it all the way up on me, and I was like this,
Yeah.
like stuck.
So that we don't want to do. We can turn it up that high, but we don't want to do that. And so we want to caution our patient, don't turn it up to a muscle contraction if we're trying to be continuous. You just want a buzzing sensation.
Could you put together a Russian protocol or something like that?
Not with the TENS unit. We have a unit that's portable, it's called EMS,
Right.
electrical muscle
Okay.
stimulation.
Okay.
And it's designed to do the same thing Russian does. It's not designed to do the same thing.
Okay.
Now, I'm gonna turn it up a little bit. Turn the other side up. Alright, now what I'm gonna do is I'm gonna play with the rate.
Oh, that feels weird. Kind of like a jackhammer.
Yeah. I see it.
That's at 10 pulses per second.
Oh, that is so crazy.
oh, it is like a jackhammer.
Oh,
God.
Two pulses per second, but what they're doing is they're overlapping each other when they're in tonic contraction.
Aaron's breathing heavy. Try not to sweat. He's like,
Yeah.
he's like,
Palms are
"He's
sweaty.
But most times patients find the higher. Now, if you really trust your patient, you can say you can get in here and play with these things if you want, find what setting is comfortable for you. If you trust your patient. I tend not to trust my patients. I say, leave that the hell alone. Play with just these things. All right, and we could have done it. These is one lead and these is one lead. There's not enough room to put it if his pain is right here. We're kind of bracketing it. So we could have done a cross pattern, but just know that if you're doing a cross pattern, you're not getting an interference current like you do with interference stimulation. It is not the same. And I'll tell you another thing. One thing that drives me bananas, it's up there on the level of doing a home program for their therapy in the clinic. Granted, you have to check their home programs, but that shouldn't be your only treatment. Is doing this in the clinic. Okay? If they have this at home and they come in and say, let's put you on some TENS, then they don't need the hell to be coming into your clinic. Because they got this at home. Alright, these things, they used to be back in the day, you could only get them from a doctor or a physical therapist. The average schmo could not buy them. Now an average schmo can go to Walmart and buy a TENS unit.
That's why they got people, you know, they're drinking the beer and they have it on. Have y'all seen?
I just need to put it on their face.
Yeah. Wow.
in your face.
Yeah, see that? Posted that on my phone.
Don't just call me out like
How much are
that.
those
Like,
cost?
did you?
Yeah,
Oh,
it's this.
Yeah, they used to cost upwards of $200. Now they're about $40,
Call me
$50.
out like that.
Why do I look so wide?
I know this is the first time
I look so wide in
this is a different channel, does it matter?
Yeah, because this is going from here to here, it's going from here to here, nothing's going from here to here.
Like, no.
They even have portable
Give me your
ultrasound.
I know, we
Put
want
your
to
hand
buy
like
one.
that.
We already done portable.
You do.
She's talking
She's
about
making it.
diagnostics.
Actually, that didn't help. Scare the sleepies away.
There,
I
too.
was like, I just slap your leg backwards.
Right.
Your hand.
Now, hold on to that.
It didn't even help. It did, but it didn't.
This machine right here is just a different brand. It's a Corvette, this is a Chevy,
That was making me upset. That's what I did next time.
right? As you can see, there is our intensity switches, channel 1, channel down. Here's our timer, here's our mode, here's our on off, let's see if the battery's good. Not good. Here's our pulse width, pulse duration, and pulse rate, and hertz.
You need to be set to.
We have a constant. There's burst 1. This one has a burst 2. It really is a Corvette. Pre-mod. Notice what's happening here to the pulse width modulation. Pulse width is going up and down. There's pulse rate modulation, 65, 60. Just getting a big fat thumb out of there. Okay. And back to constant.
They're never gonna have that thing.
Okay, so you turn it up here, turn it down here. Channel 1, channel 2. Pulse width. Open it up for me. Wait, take it all the way back. Right, these buttons right here are these buttons right up here, are these dials. These two are these dials. Timer, timer. Mode, mode. Pulse width, pulse width. Pulse rate, pulse rate. Same things are on there. This is just digital, this is just analog. This one probably costs $120 to $150 because it's a little cooler. Of course, this costs more than 4 trucks. And this one gives you the, there we go. The asymmetric is not the same shape, unbalanced, because there's more under here. This gives you the waveform. It's really not super important that you know what the waveform is, other than it's bi-phasic. Right. Like I said, this is more for clinical purposes because you may be asked to set somebody up on a TINS unit in the clinic. I have run across one question in almost every practice exam that I've seen that asks you something to the effect of, this is a portable electrical stimulation unit designed for pain control only. What is it? TINS, NMES, IFC, high volt. By the way, I didn't introduce this. This is TINS, acronym for transcutaneous electrical nerve stimulation.
Only used for pain.
It's used for pain. Pain control.
So do we just turn the 2 things up every time inside of there? Cause you remember you just turned them all the way up.
I did. That's what I do, just to simplify things.
Mm-hmm.
See, tell them what happens when I turn the pulse rate down.
It was.
Because it's not hitting him as long. So to compensate, I have to turn this up higher.
Your pants on fire.
I can feel that.
See, that's almost all the way up to 8. Now look what happens as I turn the pulse rate up.
Stop.
So that's the relationship.
Is that? Why is that
The
hot?
thing that I find most difficult is remembering which way to turn the dials and turn them off.
It's hot. What?
That's right, Mitchell?
Yeah, it's off.
I would spend some time studying the strength duration curve because I have seen a few questions on practice exams over the strength duration curve.
It's very dangerous. What? She said that's not right. I'll take the phone back. I should
Huh?
Now, I don't know that I was gonna check you off over this, as long as everybody tries it.